This is a presentation about anxiety disorders. I'm going to go briefly over the various types of anxiety disorders, but mainly focus on their treatments. Before we go into anxiety disorders though, let's define the difference between fear and anxiety. We all experience fear and anxiety from time to time. Fear is a response to an immediate external threat, such as when you're being chased by a bear. It's characterized by an emotional, so you feeling scared, a physical, something like your heart rate going up, and a behavioral response. In the case of being chased by a bear, you would be running. Anxiety has a similar response. However, anxiety is not as closely tied in with fear, or with the threat, that is. So anxiety can occur before a threat, such as when you're walking alone at night and you anticipate getting attacked. After a threat, so after a traumatic experience like witnessing a death, or with no identifiable threat. Anxiety is not necessarily a bad thing. It can be adaptive, such as when you're walking at night, it may be a good idea to be slightly distressed, slightly uneasy, so that in case you do encounter some sort of threat, you're able to take the necessary measures to protect yourself. However, when anxiety starts to take over your life, when it prevents normal functioning and causes major distress, it becomes a disorder called an anxiety disorder. And anxiety disorders are the most common class of psychiatric disorders. So what are the types of anxiety disorders? So the first class is generalized anxiety disorder. Basically, this is when, on a day-to-day basis, you feel an excessive level of anxiety. And there's no specific cause in this disorder. It can be numerous things, like work, money, safety, health. The combination of these things causes enough of a level of anxiety that it starts to interfere with daily functioning. Another type of anxiety disorder is obsessive-compulsive disorder. Obsessive-compulsive disorder is characterized by two things: obsessions and compulsions. Obsessions are basically impulses or ideas which provoke anxiety. And compulsions are things you do to lessen that anxiety. So for instance, having the feeling that your hands are contaminated after shaking someone's hand would be an example of an obsession. An example of the compulsion would be excessive washing, possibly to the point of bleeding even. Panic disorders are another class of anxiety disorders. Now, panic disorders are characterized by multiple panic attacks, recurrent panic attacks, to the point where you even fear another panic attack. What is a panic attack? A panic attack is basically a sudden, brief, intense fear and distress that triggers severe physical reactions. And so panic disorder is the reoccurrence of these things. Now we have phobic disorders. Phobic disorders are basically unreasonable fears of situations, circumstances, or objects. So an example of a situation would be being outside of your house, such as in the case of agoraphobia. An example of a specific phobic disorder would be something like arachnophobia, where you're specifically scared of spiders. Stress disorders is another class of anxiety disorders. In stress disorders, we have two types. We have acute stress disorder, and we have post-traumatic stress disorder. The difference is basically the length of time in which you experience the disturbing recollections and images of whatever event precipitated the stress. So for instance, if you experience someone getting murdered, you might have recollections, images for weeks, possibly even months afterwards. And these would be very disturbing images, and they may even interfere with your sleep. But eventually, they would subside. In post-traumatic stress disorder, you may have very chronic long-term reoccurrences of images, recollections that interfere with daily life and interfere with sleep. So now let's talk about the treatments of the various anxiety disorders. Let's start with generalized anxiety disorders. There are two main treatments: drug therapy or pharmacotherapy, and cognitive behavioral therapy, which is basically altering your thoughts and behavior. The greatest benefit in generalized anxiety disorder comes from a combination of both of them. So what sort of drugs would we use? Well, one big class of drugs is anti-anxiety drugs, or benzodiazepines, which include drugs like Ativan or Valium. These drugs are good for short-term relief of anxiety, but with continued use, there may be a dependence, and they may cause drowsiness. Another class is buspirone, or Buspar, which is for more long-term relief of anxiety and may take several weeks to become effective. Another class we use is antidepressants, which include the selective serotonin reuptake inhibitors, such as Prozac, or the serotonin norepinephrine reuptake inhibitors, such as Effexor. And lastly, we have the TCAs, or tricyclic antidepressants, a slightly older class of antidepressants, which include such things as tofranil, and this class of drugs has a risk of serious side effects. So what sort of cognitive behavioral therapy do we use for generalized anxiety disorder? So the problem with people with generalized anxiety disorder is that they distort information coming in from the environment. We call these cognitive distortions. And these things increase their anxiety. So for instance, overgeneralization. Overgeneralization is a broad rule from limited occurrences, such as if one test goes bad, you may imagine that all tests in the future will go bad. And this may result in chronic anxiety. Another type of cognitive distortion is arbitrary inference, which is concluding something with no supporting evidence, such as thinking someone hates you with no rational grounds. The goal of cognitive behavioral therapy with generalized anxiety disorder is to identify and replace these distortions with rational and realistic views, and this is done by talking and communicating and discussing with your therapist. How do we treat obsessive-compulsive disorders? These things are very difficult to treat and may require lifelong treatment. The goal being to bring the symptoms under control, to help control these compulsions and reduce the obsessions. The two main treatments, again, are drug therapy and cognitive behavioral therapy, and a combination is best. So what sort of drug therapy? Well, once again, we can use antidepressants, such as SSRIs, TCAs. The goal is to control the signs and symptoms with the lowest possible dosage, and this may take weeks to months to notice improvement, and may even take several medications before finding the right one. What sort of cognitive behavioral therapy do we use for OCD? Well, the approach is what we call exposure and response prevention. So what we do is we expose you to the thing which triggers your obsessions and causes the anxiety. So for instance, if you're obsessed that your hands are contaminated, then handshaking would be the exposure. The response is basically learning to resist the compulsion, such as in the case of contaminated hands, vigorously washing your hands. By repeated exposure to the thing which causes your obsession, and by learning to control the response, we hope to decrease the anxiety associated with the obsession and help increase your ability to reduce the compulsion, or resist the compulsion, that is. And this often requires practicing outside the therapist's office. So you would usually start off by doing this with your therapist, and over time, once you have a little bit more control over your compulsions, you would start practicing this by yourself. Sometimes, however, pharmacotherapy and cognitive behavioral therapy aren't enough, in which case we have to try other things. So psychiatric hospitalization is one possibility. Another is residential treatment, where you basically spend longer time with health professionals which help you learn to resist your compulsions. Electroconvulsive therapy, we apply an electric current to your brain and hope that this can correct the obsessive compulsive disorder. Transcranial magnetic stimulation, we use an electromagnet, but otherwise very similar to electroconvulsive. We again induce a weak electric current in the brain. And lastly, we have deep brain stimulation, in which case we implant a brain pacemaker which sends impulses to specific regions of the brain. So what about panic attacks and panic disorder? How do we treat this? So first of all, the goal is to reduce the symptoms and learn to cope with the panic attacks. And we use both drug therapy or pharmacotherapy and psychotherapy. However, in this case, we usually start with one type of therapy, although in some cases combinations may be beneficial, such as if you have severe panic disorder. So what sort of drug therapy do we use? Once again, we can use SSRIs, selective serotonin reuptake inhibitors, or SNRIs, selective norepinephrine reuptake inhibitors. We can also use anti-anxiety medications like benzodiazepines. What sort of psychotherapy do we use for panic disorder? Well, once again, we can use cognitive behavioral therapy. And the goal is to recognize triggers and learn to cope. So one of the things you would do is recreate the panic attacks with your therapist and practice controlling the symptoms. Another approach to psychotherapy is called psychodynamic psychotherapy. The assumption here is that unconscious motives and conflicts dictate your present behavior. So there may be something subconsciously which is causing the panic attacks to occur. So if we can bring these subconscious conflicts to the surface and deal with them, we may be able to eliminate the symptoms of the panic disorder. Now let's talk about phobic disorders. Most phobic disorders, unfortunately, don't improve on their own. The goal is to manage the reaction and reduce the anxiety to the object or situation of which you're scared. This may require pharmacotherapy, behavioral therapy, or both. So what sort of pharmacotherapy do we use? Well, again, we can use SSRIs. We can also use beta blockers, which reduce some of the physical effects associated with phobias, such as increased heart rate. We can also use monoamine oxidase inhibitors, which is an antidepressant, and may be used if SSRIs are ineffective or intolerable. So what kind of behavior therapy do we use? So one sort of behavioral therapy is called desensitization therapy. The idea is to expose you increasingly to the object of your phobia, and over time, hope that you become desensitized to it. So for instance, in the case of arachnophobia, where you're scared of spiders, this may start with looking at pictures of spiders, and then moving to viewing real spiders, and finally to holding spiders. What sort of cognitive behavioral therapy do we use for phobic disorders? Well, basically the goal is to alter your thought process and to change your view from fearful to healthy. Now, different phobias require different treatments. We have the specific phobias, in which case you're scared of a specific object or thing. And in this case, behavior therapy works best. We have social phobias, where you have a fear of being in a social environment. And what works best for this is antidepressants or beta blockers and behavior therapy. And lastly, we have agoraphobia, in which case SSRIs and behavior therapy work best. Now let's talk about stress disorders and their treatment. The best treatment for stress disorders is a combination of pharmacotherapy and psychotherapy, the goal being to reduce the symptoms of stress and help cope better with the stress. So what sort of pharmacotherapy do we use? Well, we can use antidepressants to help with the depression and anxiety and help improve sleep and concentration. We can use anti-anxiety medications, which reduce the anxiety and stress. And unique to stress disorders, because people with stress disorders often have problems sleeping due to nightmares, we can use a drug called prazosin, which reduces or suppresses these nightmares, helping these people get better sleep. What sort of psychotherapy do we use for stress disorders? Well, we can use cognitive therapy again. And the idea is to identify and replace these thoughts and learn to cope with them. We can use exposure therapy, in which case we continuously recall the traumatic events with your therapist, for instance, and discuss them, hoping to learn to control the thoughts and feelings which occur upon thinking about this event. Lastly, we can use something called eye movement desensitization and reprocessing, or EMDR. The goal here being to alter the reaction to traumatic memories. What they do in this is they ask you to recall the memories, while at the same time asking you to focus with your eyes on other stimuli, such as following the therapist's hands with your eyes. And the goal here, again, is to reduce the stress associated with stress disorders, so to treat the symptoms.